I miss you all for 5 or 6 weeks. I don't remember how much passed from our last session. Today, I want to talk about the validity of tests. It is very important, and I think after lunch and afternoon is not a good time for talking an important issue. So, if you help me, and if you, is there any problem? I think she wants to talk. Okay, I want you to help me and to participate in the questions, to discussions, because it's helped me to introduce issues much simpler. And also, I think that if you participate in questions and try to answer, the right answer is not important for me. It is not at all important. Just your participation is important for me. Okay, so today we want to talk about a test. All of you have heard that one test may have false positive results and also may have false negative results. False positive means that the result of a test may be positive, but the patient is not ill, is not sick. Okay? For example, fever is a sign of pharyngitis. So we expect that every people with pharyngitis also have fever. But some people with pharyngitis does not experience fever. It means that their sign of fever is negative, but people have actually the disease. It means false negative. Or another direction is that some people may have fever not due to pharyngitis, but due to common cold. So in this situation, the results may be positive, but the patient does not have pharyngitis. It is called false positive. We want to talk about false negative, false positive test results, and also talk about sensitivity and specificity. You have heard about them. You will hear about them many situations. Whenever you prescribe a test, whenever you order for conducting a test, you have to think about sensitivity and specificity of the test. Okay, but we want to differentiate the test between diagnostic test and screening test. So I want one of you be candidate and explain the difference between diagnostic test and screening tests. Who want to talk? Yes.
For example, and the scar, and the test, for example, test of the blood, of the sugar, then why take the blood or the
Oh, and what is the difference between screening and diagnostic? We can use blood tests both for screening and also for diagnostic. What is the screening? What we do in screening? In screening, we select some people that may have the disease. So the positive test result does not mean that this person actually and certainly has the disease. It means that if screening test is positive, it means that this person have a higher chance of get disease. But by diagnostic test, we want to be certain that he or she has disease or not. Okay, so we can say that whiteboard here. by screening test. By screening, thank you so much. By screening, we select some people who may have the disease. It means that after positive result of screening, we have to conduct some more sophisticated tests. More sophisticated means that a test that is more exact. Usually for screening, we use a test that is simple, that is cheap, that is acceptable, that we have access in the whole country, that is not, related to laboratories. It does not need any equipment. So usually for screening, we use simpler tests. And simple tests may not be as accurate as expensive ones. Screening tests.
We have taken a screen test. We start with Shiva, one and after the effect positive, we start with the
If the simpler test is positive, we can go further and order a more expensive test to be certain, okay? But for both screening and diagnostic tests, we should evaluate the accuracy of the test. If test should be tested and should be evaluated whether false positive or false negatives are high or low. All tests have some false positive results and some false negative results. We cannot find any test without any false results. All tests have false results. We want to select the test with lower number of false results, okay? So, we need a gold standard. Gold standard is the most accurate available test. For every disease, we can find the most accurate test that is available for us, but we cannot use this test for all people because it may be expensive. We have mentioned that this may be expensive. We may need some equipment. It may be, timely, for example. No available. Some cultures need, for example, 24 to 48 hours to results be ready for interpretation. It may be difficult, it may be invasive. Some tests are invasive, so these tests may not be acceptable by the total population. You cannot ask every people in the country, please give us some samples of your, for example, your liver to be sure that you are healthy or not. But if we take some blood from people and if the enzymes are high, we can then ask them, your enzymes is high, you may have some liver disease and you may go to the laboratory and take some biopsy from your liver, okay? So we need a gold standard, and if the result of gold standard is positive, it means that this person actually have the disease. So the gold standard gives us the not true positive. We will discuss about. Please mention your comment a few minutes later. Positive means that the person actually have the disease. And negative means that we are sure, 100% sure that person is healthy. Healthy means that does not have this specific disease. He or she may have some other diseases that are not important for me. When I'm looking for cancer, positive means that she or he has this kind of cancer, and negative means that she or he does not have this kind of cancer. He or she may have some cardiac disease or other kinds of cancer. We are speaking about one specific disease, one specific cancer, for example. So based on golden standard, we can divide people to people who actually have the disease and people who actually are normal. At the same time, we have a new test. We have a new test that is much simpler, less expensive, more affordable, more acceptable, and the results may be positive again or may be negative. So we have four situations. This cell is positive because the result of new test is positive. This cell is again positive because the result of test is positive. But this one is falsely because we know that he is healthy. So it is false and this is true positive. This one is negative because the test result is negative. But we know that this is false negative. So the positive gold standard is a summation of true positive and false negative. Okay? Positive by gold standard is a sum of true positive and false negative. True positive means that person actually have the disease and the test results also is positive. False negative means that this group of people have the disease, but the test results are falsely negative, okay? And this is true negative. This cell is good and this cell also is good because they are true. And we do not like this cell and we do not like this cell. These two cells are wrong. Now a question, which cell is more dangerous for us, for public health? Both of them, but which one is more important? False negative. You are right. Usually false negative is more important for us because if the disease is infectious, is one patient can spread disease to other people. If we miss false negative, he or she can spread the disease to other people and can produce an epidemic, outbreak.
And even if he was in the first stage of disease, so we can't treat it as him, but if it's false, so...
If we discover it, this group of people, and offer them treatment, we can prevent progression of their disease. If we miss them, then they may go further and their disease may progress to worse cases.
Doctor, within dangerous because example in false negative, example in cancer, we need diagnosis in the early time. But in false negative, don't diagnosis.
So false negative is very important. What about false positive?
How about because example treatment in the effect of the body.
Yes. Go on.
Yes, exactly.
Continue.
False positive in very important because in the treatment in the effect of the body.
Yes. Side effects.
Yes. Take an example in false positive in cancer. Disease in cancer. This
Yes.
fairly chemical is the very effect of the body.
Depression, anxiety, angry, stigma. What's the meaning of a stigma? Do you know?
Because he or she thinks it's sick, but there is any disease.
He or she is healthy, but we may offer he or she some treatment that is expensive. For example, in chemotherapy for cancer, usually our treatments are very expensive. Many treatments for chemotherapy have high chance of side effects, serious side effects. We may produce angry, anxiety, depression. Some people may lose their jobs, lose their family due to false positive results. So both false positive and false negative are important. But in some cases, false negatives are much important. And in some other cases, false positives may be much important than false negative. So the right answer for this question, which one is more important, it depends on the nature of the disease. It depends on the disease. For infectious diseases, usually we have some more fear from false negative because they can produce an epidemic, an outbreak. In non-communicable disease, in cancer cases, we may have also a fear from consequences of false positive. And we should select a test with lower false negative and lowest false negative and lowest false positive rate. We will discuss about choosing between false negative and false positive in another example later on today. Okay? Inshallah. I provided two figures here. The left side, in the left side, you can see that there is a distinct border between negative results and positive results. This is the distribution of negative test results of tuberculin test, or PPD. In tuberculin test, we inject a small amount of antigen of tuberculosis in the forearm, and then measure the diameter of induration, the swelling. If the amount is less than 10 millimeter, we can say that she or he is normal. And if the diameter is more than 10 millimeter, we can say that she or he has an experience of exposure to tuberculosis. In this case, the differentiation between positive and negative is very simple because there is no overlap between these two groups. The overlap means that, for example, in blood pressure, if we divide people based on their level of blood pressure and say that every people with higher amount than 140 are hypertensive, there is a chance that some people may have higher blood pressure, but they may not experience any consequences of blood pressure. So there may be some false positive results. Some people may have blood pressures higher than 140 when we measure their blood pressure, but they may not need any treatment because if we follow them, we will find that no complication will occur. No cardiovascular complication, no cerebrovascular complication. And if we say that every person with blood pressure less than 140 are healthy, there may be a problem of false negative results. There may be some people that if we left them untreated will experience some cardiovascular, some kidney diseases, some cerebrovascular accidents. So it may be an overlap between healthy and ill people. This overlap makes it difficult for us to differentiate them. I will return to this example to this issue by a better example. So in the real world, we have two scenarios. The first scenario, the negative results and positive results are separated by a sharp border. And in another situation that is more common, there is an overlap between people who have disease and people who are disease-free. And it is difficult for us to differentiate between these two groups. Okay. So when we are talking about the accuracy of a test or the validity, accuracy and validity have the same meaning. When we talk that one test is accurate, it means that the test results are valid. The validity is defined by sensitivity and specificity. The sensitivity shows us that
to distinguish the people who are.
Thank you. Yes. Sensitivity, it is a proportion. True positive divided by
Plus,
false negative. The denominator is the total people who actually have disease based on gold standard. And we know that based on gold standard, some people have the disease and the test result is positive. Some people have the disease, but the test result is negative. So sensitivity is the division of true positive by true negative divided by true negative plus false positive. Okay. So it is very important. When we are talking about sensitivity, we are talking about the disease group. Sensitivity is measured in people who actually have the disease. And the specificity talks about people who are healthy. So these two indices are talking about two specific and so distinct population. If I asked you, the sensitivity of a test is 90%. If I tell you that a sensitivity of a specific test is 90%, and the question is that, which percent of healthy people will have positive test results? Yes. Sensitivity of a test is 90%. Okay? The question is that which percent of healthy people will have positive results? The sensitive 90%. Which percent of healthy people will have positive results? 90, 30, 10? We cannot answer this question. Because sensitivity talks about the disease people. I have mentioned that sensitivity tells us that which percent of disease population will have positive test results. When we are talking about healthy people, we should talk about the specificity. You need a specificity to answer this question, okay? And let's go ahead. First, repeat the definition. Sensitivity of a test is defined as the ability of the test to identify correctly those who have the disease, and specificity, the ability of tests to identify correctly those who do not have disease. People who don't have the disease. So when we are talking about healthy people, we should tell something about specificity. When we are talking about ill group, people who have the disease, we have to talk about sensitivity. Sensitivity is not related to healthy people, and specificity does not have anything to tell about healthy group, okay? So it is very important for us. I will return again to a 2x2 table. We have a 2x2 table, 2 rows and 2 columns. Rows are allocated to the test results and columns to the gold standard. Gold standard means that the reality. What is the actual reality based on the most accurate test that is there? Gold standard. Actually. So this is gold standard, positive, negative, and this is test result. True, positive, false, positive, false, negative, and true, negative. TP plus FN, FP plus TN. And sensitivity, true, positive, okay. What is the prevalence of disease in this population? What is the prevalence? Let's go back to some 9%.
Let us calculate.
Calculate, please.
Yes, 9%.
How many people actually have the disease? No. 90 people have the disease and their test result is positive. How many people actually have the disease? 110. 110 people actually have the disease out of 1,000. So the prevalence is 11%. Yes? But out of these 110, 90 of them have positive test results. So 9% of the population have the disease and at the same time have positive test results. So the prevalence of disease is 9% plus 2%. 9% have the disease and have positive test results. 2% is 2%. 2 out of 1,000. These 2% have the disease, but the test results are negative. And we judge based on the gold standard, not based on the test results. So if the question is that which proportion of the population actually have the disease? 11%. Which percent of this population have positive test results? 18%. Which percent of population have positive test results? We have 1,000 people, 180 of them have positive results. I did not talk about having disease. My question was that what is the prevalence of positive test results? The prevalence of positive test results is 80%. The prevalence of disease is 11%. The prevalence of disease who are test positive is 9%. The prevalence of ill people with negative test result is 2%. Yes.
So when you want to talk about prevalence, it means calculate for the people who have the disease. Actually have it.
No. Thank you very much. When we are talking about the prevalence, we are talking about the proportion of the population who have some specific characteristics. We can talk about prevalence of disease. We can, but when we are asking about prevalence of positive test results, then the outcome is positive test results. Okay. For example, what is the prevalence of male people in this class? For calculation of the prevalence of male gender, we have to calculate the number of male people. Do you have any disease? You may have or may have not. Okay. When we are talking about the prevalence of male gender, it means that we have to count the number of male students and divide by total number of the students. When we are asking about the prevalence of headache, then I have to count total number who have headache. When we are talking about prevalence of positive test results, then we are talking about the outcome. The outcome in this situation is positive test results. It is not important for me whether they have disease or they do not. Because my question was that which percent of the population have positive test results? 18%. Which percent of the population have negative test results? 82%. Which percent of population are healthy? 89%. 89% are healthy. 82% have negative test results. 80% true negative. 80% are healthy and at the same time their test result is also negative. 80% are healthy. This group are healthy and the test results also is negative. But there is another 9% that who are healthy but the false positive. Okay, so 89% of the population are healthy. Out of these 89, 80% have negative test results and 9% have positive test results. So when I am asking about the prevalence, please concentrate on the prevalence of what? Prevalence of disease, prevalence of healthy, prevalence of test positive, prevalence of disease people with test positive. Each question may have a specific and different answer. What is the prevalence of disease people with negative test results? Disease people with negative test results, 2%. Prevalence of disease people with negative test results. Disease people with negative test results, 2%. They have the disease, but the test result is negative. 20 out of 1,000.
Say just negative test result. Don't say have the disease or.
If I ask what is the prevalence of negative test results, 82%.
Yes.
But I ask what is the percent or prevalence of people with disease and negative test results. And, yes, and is very important. And means that this group should have two criteria. First criteria, having the disease. Second criteria, negative test results. So these 20 people have the both criteria. First, have the disease. Second, the test result is negative. These frequencies is important for the tomorrow, for the next session. In next session, we will return. Yes. It's related to next session.
Can we see the say percentage sensitive of gold standard is 100%?
Yes. Actually, we don't have any test with 100% gold sensitivity and specificity. But as this is the best test that is available for us, we assume that its sensitivity is 100% and its specificity is also 100%. Okay. Very good question. When we are talking about the gold standard means that a test that is the best available test, the most accurate test that we have. Okay? So, as we don't have any better test, we cannot find whether these results are true or false. For knowing whether this is true or false, we have to compare it with a better test. But we know that this is the best test. So there is no comparison. So we assume that we believe that the sensitivity of gold standard is 100% and the specificity of the gold standard again is 100%. Yes, thank you. Okay. So in this simple example, we have 1,000 people, 100 of them actually have the disease based on the gold standard. Based on the true characteristics. True characteristic means gold standard. So based on gold standard, 100 have the disease, but the test can identify just 80 of them, and 20 of them are missed. Okay?
This percentage is for test.
Yes.
It's for test.
For test. For gold standard, there is 100%.
But there is a relation between sensitivity and specificity.
There is any relation between sensitivity and specificity. Yes, you are right, but a few minutes later we will find that there is some relationships. Now,
there is for example, sensitivity. Slightly, this means the specificity.
yes, yes, actually, there is no relation between the sensitivity, maybe 99%, and specificity at the same time, maybe 0% to 100%. Because this SEN, S-E-N, talks about ill people, and SPEC talks about healthy people. There is no relation between sensitivity and specificity, okay? Actually, in this example, specificity is 89% and sensitivity is 90%. There is nothing new in this slide. This slide talks about gold standard and says that to calculate sensitivity and specificity of a test, we must know who really has the disease and who really does not have. This is, this is, evaluated by gold standard. And gold standard may improve. Gold standards may change. For example, in 30 years ago, the gold standard for an infectious disease was culture. For diagnosing tuberculosis, we had to culture a specimen in the media, and after a few weeks, look at the culture whether this is positive or negative. So gold standard for tuberculosis in, for example, 30 years ago was culture. But now gold standard is PCR. Maybe in future a better test may replace the current gold standard. So the gold standard is the best test that is available right now. 2 years later, maybe a better test replace the current gold standard. Gold standard is not constant. By progress of science, new tests with better sensitivity and with better specificity may replace the gold standard. This is repeat. This is repeat. And this is again repeat. But the problem is that in this example, sorry?
I tried to understand this slide again and again.
We will discuss it, don't worry. Please assume that based on the gold standard, we know that the left part of this slide have the disease and the right part are healthy. Based on gold standard. Based on gold standard, we know that the blue color shows the diabetic patients and the red color shows healthy people. We need a cut point. Cut point means a point that higher than this amount are called diabetes and lower than this amount is called healthy. Cut point is a point that differentiates healthy people from ill people, okay? If we select a very high level of blood sugar, for example, what is the level for differentiation between diabetes and healthy? 126, okay? If we select 180, we know that 126 is currently the definition of diabetes for fasting blood sugar. If we choose a very higher level, we discover that this is true positive and this is false negative. By selecting a very high amount, we discover that the percent of false negative increases. So in this case, what is the sensitivity in this case? 25%. 5 divided by 20, 25%. And what is the specificity? 80 divided by 20. So by selecting a very high level, the sensitivity drops, but the specificity is reasonable, is good. If we choose a very low level, for example, 120 milligram, 120, the false, true positive is good. False negative is relatively low, but false positive is very high. What is the sensitivity in this example? 85%. Thank you. And what is the specificity?
70.
80 از 20. 75%. 15 out of 20. We have 15 divided by 20.
The number what's this number? Calculate.
There's a problem. There is something about this is yes. Actually, we have just 19 points in this example. This is not very important. Some things between 70 to 75% is the specificity. What do I want to say? By increasing the level, the cut point, sensitivity decreases or increases? Sensitivity decreases and the specificity increases. When I lower the amount of cut point, the situation is in the opposite direction. Let me show another example that may be better. This figure has two parts. Now please just concentrate on the upper part. Upper part of this figure shows the distribution of random blood sugar of a group of healthy people. Without disease. Healthy people means that this group of people do not experience any complications of diabetes. If we follow them, in this example, the scientists follow this group of people and notice that after 5 or 10 or 15 years of follow-up, nobody of this group experienced diabetes. So, based on gold standard, we know that all these people are healthy. But the bottom shows the distribution of blood sugar, but this time in diabetes people. What is the range of blood sugar in healthy people? Healthy people, something's about 50 to 190. Something between 50 maybe. No, 80 is about disease people. The upper part shows healthy people. These are healthy. The blood sugar of healthy people starts from 50 to something's about 190. All of them are healthy. Based on gold standard, we know that all these people are healthy. All this group of people are healthy. Diabetes means that people that if we do not treat them, they may experience some complications. Diabetes is not the amount of blood sugar. The amount of blood sugar is a test for diagnosis, and this test may have false positive and false negative test results. And what is the distribution of diabetes? From 90 to 300 and maybe 70. Okay? This is not normal. The distribution of blood glucose of diabetes people. Now, we need a cut point that differentiates healthy people from diabetes people. Which cut point can differentiate these two groups? There is no cut point that completely differentiates them. Each cut point has some false positive and some false negative. Okay, We have, I will provide you 3 scenarios. The first scenario, if we choose this one, if, for example, we choose 55 and say that every people with blood glucose greater than 51 have diabetes, and every people with blood glucose less than 1 are normal. What is the sensitivity of this cut point? Sensitivity means that which fraction of cases are diagnosed. Which percent of actual diabetes cases can be diagnosed with this cut point? 100%. How many diabetes cases have blood glucose less than 55? No one. All diabetes people have diagnosed. So if I choose 55, it means that the sensitivity of this test is 100%. What is the specificity? Specificity is 0. The specificity is 0 because all healthy people are classified as this. Thank you. Thank you very much. So, in this case, sensitivity is 100% and specificity is 0 because by selecting this point, all healthy people are classified as having disease. So it is not good.
So how we can choose that one?
We will talk about it. If we use this point, and classify to have diabetes and to do not have diabetes, again the sensitivity is 100%.
Yes.
But what about the specificity? Not 0. This small group of the healthy people are classified as healthy, and about 80% of healthy people are classified as having disease. This is false positive. False positive. This is true negative. Based on this cut point, almost 70 to 80% of healthy people are classified wrongly as having diabetes. So the specificity is very low. When false positive is high, it means that the specificity is low. So sensitivity is good, is complete, is 100%, but the specificity is very low. Next scenario. Next scenario is this point.
Sensitivity low.
Sensitivity is not so good because almost half of the actual diabetes cases are classified as healthy. This is false negative. This group are true positive. This group are true negative. These are negative. Positive and negative. These are negative. Is it correct or wrong? This is correct. I will repeat. When I am talking about sensitivity, I am talking about the bottom because sensitivity is about disease people. So when I'm talking about sensitivity, I am talking about the bottom part. So in the bottom we have true positive and false negative. When I am talking about specificity, I am talking about the upper part of this figure. If we say that every people with blood glucose less than 200 is healthy, it means that all healthy people can classified as healthy correctly. So the true negative is 100%, and we don't have any false positive. None of these cut points are good. Maybe the best cut point be some things. Before selecting a range, your friend talked about 126. If we select 126, the sensitivity is relatively good. The sensitivity is not 100%, is not complete, but majority of cases are selected correctly. And specificity is also good. This is false positive, and this group are true negative. So by dividing true negative by true negative plus false positive, specificity is acceptable, and by dividing true positive by true positive plus false negative, the sensitivity is also acceptable. And I'll return to your question. How can we select the best cut point? How? Help me. No. Normal, it means that what is acceptable. How can we select which point 126 is better, or 120 or 110? How can we select this point? It depends on the sensitivity and the specificity, yes. And for a more complete